I am Dr. Dinesh Jothimani. I am a consultant liver transplant physician at Global Hospitals in Chennai. Hepatitis B is one of the common causes of chronic liver disease. It affects almost 4% of the population. And majority of them live in the Asian subcontinent, particularly in India and Far East Asia. A lot of people acquire in this part of the world the disease by vertical transmission, that is from mother to child, usually at the time of delivery. Unlike the West, where the transmission is mainly horizontal through sexual intercourse. People who acquire the virus by vertical transmission, majority of them, almost 90–95% of them, do not clear the virus. Whereas patients who acquire the disease horizontally, majority of them clear the virus. So there is a distinct type of disease between the West and the East. Patients who acquire the virus vertically, they don't know they are carrying the virus. They are completely asymptomatic for a longer duration of time, unless it gets picked up by a routine screening, master health checkup, or during a blood donation camps. When the patient gets diagnosed with hepatitis B, one of the blood tests will be positive for the virus. So when they come to us, most of them panic. They are worried. But the first thing we do is just reassure them, calm them down, and explain what this virus is all about and how it's going to affect the liver and what are the long-term consequences of this illness. Presence of HBsAg in the blood tells you that the patient has hepatitis B. Usually in our country, it's acquired vertically, as I mentioned earlier. Therefore, most of the patients who I see in our liver outpatients are predominantly through vertical transmission, and they are chronic hepatitis B infection. When a patient is positive for hepatitis B, what we need to know is how much virus they have and how much damage it has caused to the liver. Therefore, we do a number of tests to see the viral count, the liver function test, ultrasound of the liver, and other small tests. If the damage is severe or if the viral load is high, they require treatment. If the damage is less or the viral load is very less, then they may not require treatment, but they need close follow-up regularly throughout their life. Because chronic hepatitis B do not cause any symptoms until late in their illness, only when the liver is completely damaged by a condition called, and results in a condition called cirrhosis, where the liver is shrunken in size and a lot of scars are deposited in the liver, and the liver itself tries to regenerate, resulting in nodule formation. This condition is called liver cirrhosis, where the liver fails to cope for the body's day-to-day activities. Even then, the patient may not be symptomatic from the disease, because we see a lot of patients with liver cirrhosis, completely normal liver synthetic function as well as normal quality of life. There is a point where the liver starts to fail. That is, the liver is unable to cope up with the body's requirements. Therefore, the patients become malnourished, very weak, and start getting tiredness. And they develop fluid in their belly as well as in the legs. The pressure inside the blood vessels to the liver increases. As a result of that, an organ called spleen that enlarges, and this condition is called portal hypertension. This results in, when the portal hypertension increases, that causes what we call as varices, that blood vessels inside the foot pipe enlarges, and after a point it gives up and results in torrential bleed. Patients who bleed from their esophageal varices have 50% mortality every time, and it increases with subsequent bleed, because the degree of liver damage also progresses with time. This condition is called a decompensated chronic liver disease. That is, the cirrhosis becomes decompensated and unable to cope up with the body's requirements. Therefore, it results in all the complications we just mentioned, like malnutrition, ascites, leg swelling, esophageal varices, and jaundice, Some patients can get confused, and this condition is called hepatic encephalopathy. One of the dangerous conditions with hepatitis B is development of liver cancer. Usually with other liver diseases, only cirrhosis causes liver cancer. But hepatitis B is very unique, that at least 10 to 15% of patients develop liver cancer even in the absence of cirrhosis. And it's a dreadful condition, because most patients we see in our clinic are quite advanced liver cancer, because liver cancer does not produce any symptoms until late in the disease. That is why patients with cirrhosis or even hepatitis B, they need a regular follow-up with ultrasound abdomen, and there are few blood tests we do them routinely for screening these patients to prevent this, so that we identify this cancer early in their illness and treat them. If you identify liver cancer in early stages, it can be completely cured with various modalities of treatment like radiological methods or surgery or liver transplantation. Not everybody with hepatitis B infection needs treatment. A condition called chronic carrier phase, where the DNA, the viral DNA is very low, the liver damage is very less. So those patients do not require treatment, but they require a close follow-up. Patients with active disease needs antiviral therapy. There are various treatments available and with excellent results. When a patients require treatment for chronic hepatitis B infection, we always counsel them and discuss about various modalities of or various options of treatment available. There are injection forms as well as tablets. The injection is called pegylated interferon. The advantage of that is it's a finite duration given for 48 weeks, and it's a once-a-week injection. And usually we give it for patients who are young and of childbearing age. However, it's absolutely contraindicated in pregnancy. And pegylated interferon has few side effects. But obviously, we'll discuss these things with the patient before we start. The tablets are there, and there are a lot of new tablets available in the market with excellent results in the long run. These tablets suppresses the virus and particularly the DNA, and prevents it from getting resistant. These tablets should be taken once a day. It's a single tablet, either entecavir or tenofovir available in the market. But patients have to take them for longer duration. The side effects are very less. The tolerability is excellent. The important issue with this tablet treatment is people generally don't clear the virus. They reduce the DNA, they reduce the degree of liver damage, but the HBsAg remains positive mostly throughout their life. So therefore, these tablets should not be stopped without any discussion with the doctor, and usually we don't stop them. Whereas the interferon is for 48 weeks, after which the drug will be stopped. But this has an advantage that some patients clear the virus in the longer run, even after stopping therapy. So we have to weigh the pros and cons with the individual patients, and we have to take it case by case. Thank you. When a patient has hepatitis B diagnosed, it is not just the patients you have to treat. It's very important to screen the family members. Usually there will be one or two carry the virus. All the relatives of the patients as well as the close acquaintances, they should be screened for hepatitis B infection. They need to do HBsAg in their blood. If it is positive, they need to go through the same tests as the patient. If they are negative, they should be vaccinated immediately. The vaccination consists of 3 doses, and it's completely preventable. Hepatitis B is a completely preventable disease. Hepatitis B is a completely preventable disease through vaccination. All they need to take is 3 doses of vaccination over a span of 6 months. you need to speak to your doctor regarding this.